Welcome back to another Research Connection. Today I'm here with Dr. Lauren Schnabel. She is an Associate Professor of Equine Orthopedic Surgery in our Department of Clinical Sciences. And today she's going to talk to us about her work on the EQ press and her lab's research focus. So your lab's research is really diverse with areas like stem cell immunology and rehabilitation methods for injured horses. Where do all of those different research fields link together?
Yeah, that's a great question. So I like to think of it as broadly, my lab studies new therapies for the treatment of musculoskeletal injuries in horses. And we do stray from that a little bit in that we also work on a bunch of ophthalmology projects with Dr. Gilger, so we have to add eyeballs in there somewhere. But for the most part, we're really focused on the musculoskeletal system of the equine athlete. So that's a pretty broad range of things from tendon injuries, which is actually where our stem cell immunology work really first started, was targeted at tendon injuries, and then treating osteoarthritis. Infectious arthritis as well has been some of our work, and then more recently some other rehab modalities. So it is pretty broad in that regard. And for some of the ophthalmology projects, we're also working on stem cells and platelet lysate as novel therapies for treating ocular infections.
And you recently completed a study on a new device, the EQ press, a compression therapy device that has been seen in humans, right? Similar. What is the comparative link between equine model, which I know is like often used for human medicine? What makes it such a good large animal model?
The horse is a model for human injuries and disease, especially in the athletic realm. They are such a good model because they're natural athletes. They naturally suffer from tendon injuries, joint injuries. They can do controlled rehabilitation, which is harder in some other species. So, for example, the pig is a great model for a lot of different diseases, GI disease, and some musculoskeletal as well. But it's really hard to make them, do exercises and go on a treadmill and those sorts of things, although you could maybe train them. But the horse is an excellent model for those reasons and because they're natural athletes. So those are clinical cases that we see, and we can also do experimental models of injury in the horse. So the EQ press is really exciting. So that is an NC State startup company called Vetletics, which is co-founded by myself, Dr. Matthew Breen, and a former student, now veterinarian, Dr. Irina Perdue. And that was actually Irina's idea. So she had worked with Team USA basketball and some NBA players that use dynamic compression for athletic recovery, so just after long training or workouts, and then also for injuries.
And talking more with the EQ press, there's recently been a lot of buzz about it, which is awesome, and congratulations, by the way. But what are the mechanics of it? What is it looking for or following when you have it on the horse?
Yeah. So it is really designed to increase lymphatic flow, which I think is also, going back to human medicine, something historically we haven't thought a lot about in veterinary species, but in human medicine, lymphatic drainage is a big deal. So for athletic recovery, that's talking about trying to remove toxic metabolites faster, waste products of exercise, etc., to make athletes feel better. But from a medical perspective, if you're a person suffering from lymphangitis, or you've had so a lot of cancer, tumor removal surgeries that involve lymph nodes. If you remove lymph nodes, people will go in these dynamic compression devices to help them with lymphatic drainage. So we were really looking at it as a whole, and one of the things horses suffer from is lymphangitis. So they can get cellulitis of their limbs or an infection and then have problems where they don't drain lymph fluid well. And horses are predisposed to build up of lymph fluid in their limbs because they have such little musculature. So when you think of our calves and then you look at a horse leg, they really have bone and tendon and no muscle, except in their very upper limb. And you need the muscle to actually propel lymph fluid up and out of the limb. So this device essentially does that for them. So it's a lot of technology from our manufacturer, which is MegoAffect, but it basically, in waves and with pressure sensor, pushes fluid up and out of the limb. So there's different chambers, and one inflates, and then the next, and then the next, and then the next. and then it deflates, but so it's pushing fluid up and out of the limb, and there's no backflow of fluid. So in the study that we recently did, it was a really cool study with radiology with Dr. Kip Berry. Justin Reynolds, our radiology tech, was tremendous in doing the scintigraphy studies, and then one of my PhD students, Drew Coe, who many of you know, who's wonderful, was the lead on that study. So basically we took a radioisotope tracer, if you want to call it, similar to how we do bone scans in horses clinically, but this tracks lymph flow. So we just injected it above their coronary band, and then watched where the how quickly the lymphatics moved up the leg into the lymph node, either with the EQ press on or not with it on. Okay. And horses that got treated with the EQ press had dramatically increased lymphatic flow significantly. So they cleared the leg much faster, and we saw that tracer isotope in the upper lymph node in the limb in all the EQ press treated horses.
So kind of following up with that and going off of, you said a lot of times your work focuses on horses as athletes. How important is it to treat these horses like professional athletes in the level that they compete similar to human medicine and professional sports? Is that how you approach your research projects with horses? Yeah.
So that's definitely the goal, and especially in our clinic cases. So we really want to be more proactive than we have been in the past. And having gotten to work now with some human physical therapy specialists and trainers, I love that. It's really cool, and to see how they approach the human athletes. And even things like, now it's sort of a buzzword, but what's called prehabilitation, where you're actually preparing the athletes before surgery. So if you can actually do some training exercises before surgery or get them used to, then they do so much better after surgery. And that's something, thinking about that from a research perspective as well, but certainly in the clinic, thinking about how can we prepare these horses for what they need to do post-operatively, which makes total sense because, they're used to training every day, working, being part of a program, and for some of them, it's really tough on them mentally as well to be in a stall. And then once if they're painful after surgery, obviously, we try to get their pain under control, but it's harder for them to learn new things in that way. Whereas if we can work with them beforehand these are the rehab exercises you're going to do. You're going to be in this barn where it's quiet and with other rehab horses so that they're mentally in a good place, then you do so much better post-operatively.